Welcome. I'm Jeffrey Goldberg. I'm the editor-in-chief of The Atlantic. Today is Thursday, April 23rd, 2020. I remind myself of the day frequently because otherwise I completely forget what day it is. This is the 4,000th day of quarantine, I believe. I want to welcome you to the Atlantic cover, which is our new digital event cast. That's what they call these things. Really glad you're with us. I hope many of you are readers of The Atlantic. I hope many of you are subscribers to The Atlantic. And I'm sure many of you have come to AtlanticLIVE events in the past. We hope that you're turning to The Atlantic for all of your news and analysis needs, especially as it relates to the coronavirus. Our writers have been covering the story from all angles, from the science, obviously, and health, to the economy, to relationships, to politics and government, everything that The Atlantic does. Today, we're going to talk about anxiety, which is a relevant subject for us. When we asked several months ago, when we asked Kate Julian, one of our senior editors and one of our great writers, to look at childhood anxiety, we did not know quite how relevant this would be when it landed. Here is the new cover of The Atlantic. I would say you can find this on newsstands, but you can't go to newsstands, so I hope you subscribe. You could also find the story online on our website at theatlantic.com. So when we thought to do this, obviously Kate came to us with some very, very interesting information about the staggering increase in the level of anxiety and depression in children. And she has a lot of interesting research and theories about why this is on the rise. And so we're going to talk a little bit today about about her findings, and also about her findings in light of the pandemic. I hope that this is particularly useful to parents, people who take care of children, because we're talking about children today. We're not talking about teens or Gen Z or college students. I mean, we could talk about that too, but we're really going to talk in depth about small children. So, Kate, welcome to The Atlantic, whatever I just called event digital simulcast, or whatever it's called. But glad to have you. Glad to have you on board. Nice organized bookshelf. I like it. I like it. Curated special. Very good. So Kate, oh, and by the way, we're going to have questions, and I think everybody in their invitation has an understanding about how to send in questions our way, and I'll be able to read those questions to Kate after we have a reasonably long conversation, 20 minutes or so. Kate, why don't you tell everyone what your story is about? What is if you had to boil it down to an overarching finding, what did you learn? And then we'll jump off from there.
So when I started looking into this, I didn't actually know that it would be about anxiety. I thought it would be about childhood mental health. And the impetus was, these numbers that you mentioned, the increases in depression, the increase in suicide. Excuse me, my AirPod just dropped out, because that's what it's like when we're doing this at home. And when I started talking to experts about all of this and asking, so, what can we do about it? What could we do to prevent this? It was weird how unanimous the response was. It was, look, if we want to do something about mental health overall at a society, we should do stuff about, poverty and adverse childhood experiences, trauma. If we want to do stuff at a family by family level, the single best thing we could do is work on anxiety among kids who are a lot younger than I would have dreamed. I'm the mother of a 6-year-old and a 10-year-old, and we're finding, according to the research, that the average onset of anxiety is age 11. In some anxiety disorders, it starts as early as 7. And the reason this is so important is that we now know that it's a gateway condition, which is to say, if you have problems like depression or substance abuse in adolescence or adulthood, like they probably started as an anxiety disorder in childhood. And the cool thing about this is anxiety is actually a lot more responsive to treatment than those other things are.
Interesting. Talk about, I want to understand this in relationship to parenting. I mean, as we were working on this piece, you were very I mean, you're a responsible person anyway, but you were particularly responsible to note that what you didn't want to end with is a piece blaming parents for creating additional anxiety in their children. But you talk about, and I want you to go into this, you talk about various things that parents can do, or parents are doing that exacerbates existing or pre-existing anxiety or stress levels. Talk about parents and that. And I'm very mindful, and we could jump into this in a minute, that we are talking about a certain kind of parents and a certain level of socioeconomic stability that allows for parenting to be sometimes over engaging or over involving, but we'll get to that in a second. Talk about parents generally.
Yeah, so the first thing to say is that we have a long history in America of blaming parents for kids' problems, and psychiatry and psychology have a pretty bad history of this, right? So we want to be really careful, and we're not saying that parents are causing mental health problems. But when you look at this sort of idea of anxiety as a gateway, and you look at what makes anxiety worse, the evidence is pretty compelling that parents can do things that make it a little bit worse or a little bit better. And those differences can be kind of substantial over time. So to understand how that works, we have to back up a little bit and talk about what anxiety is. And in fact, a misunderstanding of that is really kind of at the heart of what a lot of parents are doing wrong. The more we get concerned about the mental health crisis, so-called, among kids, the more we tend to do things to try to make them more comfortable, to reduce their stress levels, to make them feel calm and peaceful. And what I heard over and over again is that that is not mental health, right? Mental health is having the appropriate response at the appropriate time to your circumstances. In the case of anxiety, anxiety is a universal human emotion, right? We are all going to be anxious. In fact, sometimes we need to be anxious. It's adaptive. Like, we need to be stressed out when our situation warrants it. We need to worry when our situation warrants it. The problem becomes when people don't learn how to deal with that distress and that emotion. And so they start to try to avoid the feelings of nervousness and anxiety. And that leads them to avoid the things that cause those feelings. So for example, you're afraid of being away from your mom. If you don't learn how to deal with that feeling, you're going to have a hard time going to school. If you have a phobia of something and you don't learn how to conquer it, it's going to take over your life sooner or later. The problem is when parents think, oh, anxiety is bad, they sort of perversely and ironically end up doing the things that allow an anxiety disorder to flourish.
Will you talk for a little bit? You mentioned this in the piece, and I don't want to get this wrong. You correct me, but children who are unduly, I don't know how one judges that, but unduly afraid of dogs at the age of 5 that's an indicator of possible serious anxiety or serious ability to thrive issues later in life. I suppose dogs is a stand-in for a whole host of things that one could be afraid of. But talk about that, about what you would see in a 5-year-old that would make you go, this is a kid who is not managing anxiety well or dealing with the realities of the anxieties around.
So among the anxiety disorders, phobia of a specific thing, like dogs, is one of the earlier ones to typically present. Now, does this mean that any kid who's afraid of dogs is going to go on to have a lifetime of like mental health woes? No, it does not. However, it means that if you take people who as adults are struggling and you go back, as scientists have done really systematically, and you try to figure out where did their problems start, quite often it is something like a fear of this. And the problem is that these things tend to snowball. So let's say, one moment it's, I'm really scared of dogs, so I'm going to do, often with my parents' help, everything I can to avoid them, cross the street, not to be near a dog, not watch movies that, feature dogs, whatever it is. But over time, it may be joined by other disorders. It might be social anxiety. It might be generalized anxiety that keeps you from wanting to participate in life, that interferes with your ability to do, school well, to succeed at a job. And so, as one of the experts quoted in the piece very colorfully said, fear of dogs at 5 or 7 or whatever it is isn't important really because it's dogs. It's important because it's correlated with risk of having a bunch of other problems when you're 25.
Right. Well, this is a good way to jump into the pandemic. The question, my kids are older than yours, but I've been asking myself, since I read your piece, or since we started talking about it. You know, what would you say to a 5-year-old right now, or a 10-year-old, about the nature of the virus, the pandemic, the global crisis we're having? I suppose there's an impulse on the part of many parents to shield their children from the harsh truth about what a pandemic is.
I think that's right. And I want to back up really quickly to introduce a term that's helpful for understanding this. It's a little wonky, but it's really useful. And I think parents find it a useful way to think about it. There's a guy in the piece who I feature named Ellie Leibowitz at Yale, who's running a program called SPACE that helps parents to work on how to respond more productively to their kids' anxiety. And this program has really, really high success rates without ever even touching or talking to the kids. What they do is they help parents identify the way that they are accommodating a kid's anxiety. You know, the example I just used, the accommodation would be crossing the street so the kid doesn't have to confront the dog. In a case like this, actually backing up still further, we know that that type of behavior is correlated with worse outcomes, right? So you're more likely, the more you accommodate a kid's fears and worries, to have those fears and worries turn into an anxiety disorder. The anxiety disorder is likely to last longer and be more severe the more you do that. And we also know that it's pretty much universal among parents. Like, this is our instinct, right? And going back to the point about blaming parents, I want to be really clear about this. Like,
your
our
natural
job as
instinct
parents,
to protect your child from a bad thing.
yeah, right. I mean, that's innate. You know, we have adapted, you know, over a long period of time, we've evolved to try to protect our kids from distress. The problem is that can kind of go haywire and we can overdo it. In the case, and we know from this program, moreover, that when parents can reduce that a little bit, when they can let the kids try to cope a little bit more for themselves and develop a bit more sense of competence and capability, that the kids actually, again, it's one of these things that snowballs, that the kids actually do better over time. How this factors into COVID, I think, is really, really interesting. There are a few points we could make, but on the point about how to talk to them, I think a lot of parents assume, again, going back to this point about we should prevent stress in kids, it's better not to trouble them with this, right? And so some part of that instinct is probably right. So we could break this into a couple pieces. Like, is it helpful to have the TV on 24/7? No, it's not. It's really not. It's probably not good for adults to have the TV on 24/7, speaking from a purely mental health perspective, right? It's introducing a lot of sort of worry that you can't do anything about with relatively like low, you know, information added. Really fascinating studies were done after 9/11. After the Boston Marathon bombing, after various hurricanes that looked at the effect on kids of having the TV on in the background all the time. And it's very clear that it wasn't good. In fact, kids, you know, who were really only indirectly exposed to the events of 9/11, right, who weren't living near ground zero, who weren't directly affected, in many cases had like real anxiety that was prompted by the TV coverage. That is not to say, though, that we should not talk to them. And this is where a study that was done after the Boston Marathon bombing is really interesting. Looking there at kids in the Boston area who had to go into lockdown for a few days afterward, they found that the parents who didn't talk to the kids about what was going on, who tried to kind of pretend it's all normal, you know, we're not going near the windows, everybody's staying home from school, but it's all good, we're not going to talk about what's going on out there. Their kids really struggled in the aftermath and had much worse problems with anxiety and other sort of bad mental health outcomes. So we know, and experts have sort of reiterated this to me a bunch of different ways over the past couple of weeks, we know that talking to kids is the thing to do. We know that their minds are already going there. They're really smart. They're really observant. If you're out there in the garage spraying things down with bleach, they're not going to school, you're not going to work. They know that things are not going well on some level. And if you pretend otherwise, if you don't talk to them candidly about that, it probably makes the anxiety and the worry worse because they think, gosh, this thing is so bad that my mom or dad can't even talk to me about it.
Right. Talk a little bit, step back to some other, there's another piece of the story, very early on in the story, you talk about smartphones. There is a belief very broad belief, this is beyond just the pandemic, obviously, a broad belief, and there's been some good research and pieces in the Atlantic, actually, that talk about the unique role that smartphones play in increasing stress levels and anxiety levels, even depression levels and suicidal ideation levels in children. I'm curious to get your take on that, and you take a somewhat dissonant view on that, which is that not everything can be explained by hyperconnectivity or hyper information sharing that comes about as a byproduct of having these devices in our hands all day long. Talk about that a little bit.
Yeah, so Jean Twenge wrote the piece that you were just mentioning, I think 3 years ago in the Atlantic, which was called Have Smartphones Destroyed a Generation? And since then, there has been a tremendous amount of research on this question. And it's complicated the picture a bit. It has definitely not let smartphones off the hook by any means. I want to be clear about that. But it has made it clear that the type of use, the way you're using your phones, and what your sort of underlying vulnerabilities and predispositions may be make a huge, huge difference in how you do. So for example, they've looked at it and they find that actually, like for boys, for example, like screen time playing video games doesn't really have that much effect on anxiety, depression, suicide rates. But for girls, especially girls who have tendencies toward depression and anxiety, social media seems to be really, especially when it's being used in high volumes, really problematic. So I think what we need to do is talk a bit more discreetly about what actual activities are going on. I think taking phones away from kids is probably not realistic, especially at older ages. Like that is where their social lives are transacted. And there is some research that suggests that it can actually be helpful, right? Like kids who text more on a given day, they found, are less anxious, probably because they feel more socially connected and supported.
Can you explain that for a minute? Because that's such a interesting and possibly counterintuitive. I mean, especially if you're a parent who's around kids who are texting relentlessly all day long, it's, who could you possibly be talking to that much? But
right.
Talk about that. What is the benefit of texting for the children's emotional health?
Look, we know that friendship is deeply protective mental health wise, right? It just is. And in fact, at this moment, it's probably more important than ever for them to be texting. It can be, I think, for those of us who are a little older, who didn't grow up with that, it can be sort of confusing and alienating. But at the same time, you know, I know that I, as a middle schooler and high schooler, spent hours a day on the phone having pointless, endless conversations. You know, in terms of like the actual sort of, you know, time spent on this, it was probably greater than most kids are spending texting. It's just a different style of doing something that teenagers have always done. And we know that the sort of role of friendship and relationships is really crucial at that age developmentally.
Right. Right. Well, come to something I mentioned before, the socioeconomic differences here. We are talking about problems that, I don't want to be callous about it, but for some families would sound a bit like caviar problems.
Right.
If your worst problem is that your kid is overstressed because news events or because of school pressure or the like, you know, there are families in America, obviously elsewhere, that you know, what's that old saying? If you know, a person who is hungry has only one thing that they have to do during the day. They don't have time for a lot of extraneous anxieties. They just have to find food. So talk about childhood anxiety in a socioeconomic context, and that is particularly relevant right now with unemployment where it is and food insecurity where it is.
Right. So when I decided to focus on childhood anxiety, it was in part because we know that this is something that affects people across the socioeconomic spectrum. That being said, there is some sort of debate among anxiety researchers about whether you can really call the anxiety that's suffered by somebody who is really struggling and in stressful circumstances, whether due to poverty, food insecurity, abuse, neglect. Is that really like pathological anxiety? Like I was saying earlier that anxiety disorder is when the anxiety is out of proportion to the situation. Right. In that case, it may not be out of proportion to the situation. It may actually be protective, right? If somebody is You know, if you're around somebody who's violent, being scared of them is probably a good reaction, right? To take one very good example, like
you don't want them to put it into proportion. You want them to get the hell out of there. Right?
Exactly. So that is an open question. I mean, certainly if we wanted to do something pre-COVID about mental health in this country, like in a prophylactic, preventive, early intervention way, it would be to do something about what researchers call ACEs, which stands for adverse childhood experiences. In terms of just the volume of misery and mental health problems in this country, the single best thing we could do would be to deal with poverty, food insecurity, neglect, all of those things, 100%. Like, it is a morally urgent task. It is morally more urgent now, given that a lot of the supports that we had in place for families who were struggling are really foundering, and that we have fewer eyes on kids, right? Kids aren't seeing their doctors, they're not seeing their teachers. Like, kids who are at risk of neglect and abuse, really, we have a growing concern about what may be going on with them right now. That being said, I think, there are some good things, paradoxically, for kids across the socioeconomic spectrum about what's going on right now. And it's a very kind of counterintuitive and heterodox thing to say, but for kids who suffer from anxiety, right now is actually in some ways not such a bad time. A kid with separation anxiety, which is one of the more common problems in younger kids, like, she's pretty happy right now. Mom or dad's around all the time. Right? A kid who's got social anxiety, which is another really common problem, also may be pretty happy. But this does raise some really big questions about what's going to happen when life returns to whatever the next normal is.
How are you talking to your young kids about this moment?
So I've been trying to be proactive about it, given what I was telling you before about the research on, for example, the Boston Marathon bombing and so forth. One of my kids asks a lot of questions. The 10-year-old does. The 6-year-old does not. It's really important to not overwhelm kids with information, but to put it out there even when they're not asking. I'll tell a story about the 6-year-old that kind of puts this into light. He had started doing a little pandemic diary, not really about the pandemic, but while we were out of school and we were trying to look for things for him to do, I said, why don't you write a sentence every day about what's going on in this period of time? Just a little diary that you can look back on later. And to begin with, it was kind of anodyne, like, today I had a ham sandwich, and the next day was, today I did school on the computer. Okay. And then day 3 made my heart stop. It was a bit longer. It said, today I played tag football. I played touch football. I wish I had played tag. Today I am alive. And I was like, okay, so that's on your mind. And this is a kid who
somewhere.
And I had been trying to get him to watch little kid COVID videos and stuff like that, and he'd expressed no interest. But in fact, he needed to have that conversation. Another thing that is interesting related to this that I heard from a bunch of clinicians that I was talking to over the past couple of weeks is this. Even under normal circumstances, kids worry a lot about what would happen to them if their parents die. Like, this is pretty much a universal kid fear. And kids who are younger especially have
theme of literature. It's as old as parenthood itself.
Right. I mean, and this is part of being human. We're meant to worry about being attached to our parents because they're the ones who are taking care of us when we're really young. Kids who are younger tend to have really unrealistic ideas about what orphanhood would mean.
Right.
They have ideas from movies and from books about orphanages and so forth. And parents tend not to want to talk about this or to raise this. And the kids are scared to ask the parents because they can tell that, it might upset their parents or that it just seems awkward or uncomfortable. But in fact, you should have this conversation with your kid if you haven't, right? You should say, look, COVID notwithstanding, there's no reason to think that dad or I is not going to be around for a long time. However, there's this thing called life insurance, if you have that, or however, Aunt Jessica, would take you and exactly.
You shouldn't show your kids Oliver when they're very young. That's what you should.
Yes. Don't show your kids Oliver when they're very young. I think the literature finds that that's got really bad consequences.
Yeah, the whole Dickens thing is not where you want to go.
but just in all seriousness, the experts all said, look, like your kids have already gone there in their head. You're not introducing a scary thought to them. The scary thought is there.
Right. Let me go to a couple of questions from our audience, throw them at you. Sarah, who is joining us from Lakewood, California. I really feel like actually, I just lost that question. Oh, there it is. How do you know when your child's anxiety is at the point that you need to have them seen by a mental health professional?
So you would look for signs that it's interfering with their life and their happiness on a day-to-day level. So with young kids, they may not really articulate what's going on in so many words. It's really common that anxiety that's problematic would manifest with somatic complaints. So stomach complaints, headaches can be a really common presenting symptom of disorder, anxiety disorder in a younger kid. So can difficulty sleeping. So can asking lots of very worried questions, you know, what if this, what if that? Of course, some of these things, you know, are universal to children at one point or another. So the main thing you could do, I would say, is just get an assessment. And you don't need to wait until after this crisis is over. Therapists are doing, you know, telemedicine sessions. Insurance will usually pay for some of them. So you can get an evaluation with somebody who focuses in childhood anxiety and particularly cognitive behavioral therapy, which is the most evidence-based approach now.
Right. Interesting. So we have a question from Dave Veldhorst, who says, you, Kate, write, quote, if we want to prepare our kids for difficult times, we should let them fail at things now. But he asks, how can we do this when our culture does not seem to allow for failure or afford time to fail? With college costs so high, students have time to experiment with activities that may lead to failure. Very good question.
Well, I mean, we could step way back on this and question some of the underlying assumptions of the college admissions rat race to begin with. You know, does your kid really have to go to this college or that college? That's sort of a different discussion. I think that when we're talking about younger children, it certainly is clear that, you know, just allowing them to do things that are sort of straightforward, like chores. For example, this is something I mentioned in the piece, like people of my generation, you know, 82% of us had chores growing up, 28% of kids do now, according to one survey. Like little things like that that may be unpleasant and may, you know, be challenging can build a degree of resilience. Walking to school is another example. You know, employment outside the home during the summer, like maybe your kid could have a job during the summer instead of, you know, doing some sort of college admissions oriented thing.
Right. Here's another one from Ari Wallach. How might the increased anxiety of both this era and moment affect our children's ability to plan and think about the future? That's a great question because there's a worry that you've expressed well in the piece of not sharing enough with children, but what if they come to a conclusion, when this goes to deep issues about the American dream and the possibility or the assumption baked into American society until recently that children were going to always do better than their parents. But what if the stress level, what if the information overload is causing them to sort of curl up and say, you know what, there's no point?
Well, again, this gets into sort of very broad, almost philosophical questions about what is success, right? What is happiness? What is the meaning and purpose of life? I'm at risk of sort of repeating stuff that I know we all know, but maybe we don't always internalize as much as we should when it comes to our kids. Like sleep, exercise, friendship, like doing good for other people. Like these are the things that if you ask sort of like, what can you do to make yourself happy? The researchers, you know, come back to time and time again. Is that enough to sort of offset the type of sort of systemic economic insecurity that we're talking about? I don't know, but I certainly know that if we don't do those things, we're kind of committing the equivalent of an own goal.
Right. Here's an interesting question. What advice do you give to teachers? This is from Barry Hoonan. What advice do you give to teachers to guide anxious parents who have anxious kids?
So this is a great and tricky
I'm
question.
going to give you an advice column after this. I don't know if that would be something that you actually want, but here we are.
So schools are struggling with this so much. Like the impulses that I described earlier that parents have to protect their kids from discomfort and stress, those get funneled straight to teachers in schools. And the teachers in schools are being told by parents in no uncertain terms, like, please don't make my kid unhappy. So, you know, Fiona is really, really shy, you know, please don't call on her in class. Or, you know, Edgar, you know, is having a lot of trouble with anxiety now. He needs a pass to be able to leave the class when he feels overwhelmed. Or so-and-so needs untimed tests, extensions on homework. There are a lot of things that would fall under that category of accommodation that I was talking about earlier that schools are being asked to do. And in a lot of cases, they're complying. And researchers who specialize in this are really concerned about it. So I think one thing that schools can do is try to educate parents on anxiety and what we know about resilience so that they can see that they're actually not doing their kids any favor by asking for these kinds of adjustments. A phrase that I think is helpful to remember is short-term gain versus long-term pain. This is something that anxiety therapists have as like a mantra, right? Like that the things you do to make somebody sort of, you know, feel better right now tend to backfire in the long term in terms of preparing them for adolescence.
Do you believe that we don't have enough grit that we're not teaching grit and resilience in the interest of being soft or kind in the here and now, that we just need to teach toughness?
Well, I think you can take that message way too far. One of the things I really like about Elie Leibovitz, the Yale guy I mentioned who's doing this program called SPACE that's in the article, is that he emphasizes the need for support as well. Often what we have is like parents who, even within a family, like may kind of go to extremes. Like maybe you have mom who's being like super soft and, you know, accommodationist. And then you have dad sort of responding to that in the other direction by being like a drill sergeant saying like, toughen up, son. And, you know, neither of those things is great. We kind of want a happy medium. So a lot of this is about like, you know, being there for your kids. They need time, they need love, they need support, they need empathy, they need all of those things. This is not just a toughen up message. It's a, you know, give them those things and express confidence in their abilities and don't do everything for them.
Right, right. Well, look, everybody, this is a great article. You should read it. You can find it on our website, theatlantic.com, and you could find it in our magazine, and we all appreciate your support very much. Those of you who are subscribers, thank you. The only way that we get to do this journalism and that I get to pay people like Kate Julian to write great stories is because you subscribe and support us. If you're not a subscriber, please consider subscribing. We have many ways for you to subscribe on our website and off. And it's actually, I guess this is counter programming, but I believe that you could subscribe to any quality publication. I happen to vote for The Atlantic, but right now in this moment in our democracy, it's important to support publications, outlets that you think are doing quality, true work. And Kate Julian, who is one of our best journalists, I want to thank very much for doing this. And we look forward to your next piece. There's so much more to talk about. And just a reminder that our coronavirus coverage, most of it or much of it is in front of our paywall. So don't be shy about consuming it. One of the things you can do at the dinner table with small children is read them articles, long articles from The Atlantic. That's what I do at our house, and it's widely appreciated as best as I can tell. But in any case, thank you all very much, and please stay safe, and please keep your eye out for future Atlantic live cast events. We're going to be doing a lot of these in the near future. So thanks very much for coming, everyone. Bye.